and
Yes.
opportunities for fellowship over there.
Yes.
So there are two questions. This is the first question. So I'm going to answer your
Shalini, we
first.
are going to go live in a minute, so can we just?
Okay, okay, we will
Yeah,
stop.
yeah,
Yeah,
just a
yeah.
second. Yeah.
Okay. In the
Uh,
meantime, I'll just have a chat with you. Umed, where are
no,
you
no,
from?
just one second. I think we're nearly there. Yeah, we are on now. We can go on. Yeah, we can start now. Yeah.
Yes, ma'am.
Okay.
I am currently in Vrindavan, Mathura.
Acha,
I'm
acha, acha,
I'm a second year DNB resident over here.
acha, acha. Chalo.
And I look forward to get some opportunities abroad after
Yeah.
completing my DNB. And I have a lot of cousins in Canada, so I
Hmm.
was looking for opportunities for fellowship over there.
Hmm. So, see, so for everyone's benefit, Umed's question is recognition of DNP anesthesia in Canada and opportunities for fellowship over here. So, the primary question is how many years of anesthesia have you done?
It's a 3 year course over here. DNB anesthesia is 3 years
But
course.
before DNB, what have you done?
I have done my 5.5 years of MBBS.
MBBS. Okay, okay. So,
Yes,
so DNB, the way it is, it's like an MD program.
yes, similar to MMD program. I'm post MBBS anesthesia over here.
हाँ. तो क्या होता है the issue with Canada is that degrees are not actually recognized, so to speak.
Okay,
But they do accept, okay, you've done anesthesia training, and your training is 3 years or 4 years or 5 years. We have 5 years training.
okay,
So what happens is, at least, and every Canadian center has their own rules. Our rule is that after you've done your anesthesia training, you should have at least 2 more years of work, so that you become equal to our own residents who have done 5 years of anesthesia.
okay,
Okay. And then you can even apply now, but mostly if you're such a fresh graduate,
yes,
fresh postgraduate, you may not uh, be considered that much.
okay,
Okay.
okay,
So the second thing I actually want to tell everybody, I'm sure everybody is hearing me, immigration, PR, and fellowship and job are two totally different things. And
okay,
immigration consultants are it's a big scam with immigration consultants. They take a lot of money from people, and then they say, okay, you are a doctor, you can get immigration. Yes, you can get immigration, but you cannot get a job.
okay,
Okay. And I will tell everybody, we have the most qualified taxi drivers in Canada, because all people
yeah,
get immigration, they come to Canada, and then they don't know what to do.
okay,
Okay. Job, I mean, fellowship you can get without PR. Okay. You
okay,
don't have to be a PR to do a fellowship,
okay,
Canada wide. But the issue here is that if you get a fellowship, and this is not like Royal College Fellowship of UK, that you are a it's not an exam. So it's a 1 year, max 2 years fellowship that will end. And after that, you got to go back.
okay,
Okay.
yes,
So it just gives you a taste of what things are like. And if you want the other issue also is that in terms of residency, you have to be a Canadian or a PR to be able to apply for a residency. I mean, like anesthesia residency.
okay, ma'am,
Okay.
okay,
So unlike US, where anybody, if you are clever enough, you can apply,
yes,
but here you cannot. You have to be a Canadian. We have a very few uh, people from other countries who do not have a PR, but that's a government initiative. That's a government to government initiative. For example, we have an initiative with Kuwait. So Kuwait government sends their residents. So these people are Kuwaitis. They don't become PRs. They do residency here, 5 year residency, maybe a fellowship, and then they go back to their country. But that's a government initiative, nothing to do with universities on their own.
okay, okay,
Okay.
okay,
I
ma'am.
hope I've
Even if,
answered your question.
yes, ma'am, one more part of this. Even if we don't get opportunities for fellowship, can we join in some research part related to anesthesia so that we cover our 3 years mandatory after PR to get citizenship? Meanwhile, if we do
I'm
any,
sure you can, but If you are wanting to go that route, I would suggest, if you only want to spend 3 years in Canada to get your PR, then I would suggest do a fellowship.
Okay. But for
Okay,
that, I
but
will have to complete 5 years in India, then go over there, right?
yeah, yeah. Research positions are available all over the country, but again, they are very difficult to get. Most of them are actually unpaid research positions because not everybody has a grant. Okay, so I think
Yes,
only.
ma'am. No, ma'am. Yes, I got it.
uh, okay, what else? I think, does Hari have a question?
Hari and Jasmeet, I think you guys are very interested in asking questions. Siva,
Yes, sir. Just meet
Okay.
here.
yes, do you want to put your video on as well, Jasmeet?
Yes,
Yeah,
sir.
the over to you. Yeah.
Meeting. Yeah. Uh, Hello, sir. Hello, ma'am.
Hello, Jasmeet. I think we chatted a little bit in the
Yes,
past.
ma'am. Yes, ma'am. Ma'am, actually, my sister is there. She's a PR there. So I
कहाँ
am
पर?
very much interested. She's in Toronto,
Okay,
but she's
okay.
not a doctor. And she went in 2017. So,
Mhm,
like, they were already completed their 3 years. And so basically, we are really interested to move there. But me and my husband both are doctors. So, whatever, like, I've been reading a lot about it, but
mhm.
I don't know yet, like, what
He
path.
can join. Your husband can join if he
Yeah,
wants to
yeah.
ask questions.
He just entered
Yeah, I can
actually,
see.
come back from the hospital. Uh, so he's an ENT surgeon and I am an anesthesiologist. And I finished my residency last year in 2019. So 1 year of SRship also I have done after that.
Mm,
So as you said that it needs like we need 5 years.
mm.
So I need another year at least because I am
I
four
also
years.
want to tell you that everybody, like for example, we've already done 2021 July appointments for fellowship.
Yes, yes, ma'am. Yes, ma'am.
So if
I had
anybody
actually
is
applied.
going to apply now, that will be for 2022.
Yes, ma'am. So that's
Okay.
what then it'll be a good idea to apply now, I guess.
Mm, mm,
Because
mm,
I did apply during my residency also. I applied for the
mm.
pediatric fellowship at Sick Kids Hospital for
Sick
Sick
kids.
Kids. Yeah, so that's what because that time I didn't even have 3 years experience, so maybe that's why I didn't get accepted.
Actually, one of our success stories is one of our present consultants. She joined
Okay,
us as a. She came from India not too long ago, 2 3 years ago, 3 years ago. She did a
okay,
fellowship with us in regional anesthesia. Then she went on to do a fellowship in sick kids, and now we've hired her as a consultant in our department. So she's a
okay.
success story.
But
Mm.
ma'am, that's what I wanted to ask. That is fellowship enough? Like, how do we get the
No, it's
registration?
not enough. See, the thing
Yeah,
is, you get fellowship, and you are in contact with people, and you have to be really bright for them to pick you up.
yeah. Okay.
Okay, you have to be really bright in clinical stuff. Routine clinical anesthesia everybody can do.
Yes,
So if
ma'am.
you think you are a good anesthetist, everybody is a good anesthetist.
Yeah, yeah,
Let me tell you. And everybody can intubate, everybody can do blocks, everybody can do spinals. That is
yeah.
not what people now are looking at. They are looking at what else do you bring to you, bring on it. Hi, Jady.
Yeah, Jody is here as well.
Yeah,
So he's
he
also one
can
of the
contribute to
program
this
directors.
question as
Yeah,
well.
yeah. So he
So
does sick children. Yeah.
yeah, sick kids.
Okay.
Jady, we have Nivedita now.
Mm. Hi, Jody. Um,
I think you are muted.
Jody, can you? Yeah, yeah. Hi, Jody.
I think I can't hear him, so I'll continue with you, Jasmeet. So that's the situation. The employers are looking at what do you bring to the table.
Yes, ma'am.
Are
Okay.
you bringing your research capabilities? Are you bringing your exceptional educational techniques? I mean, there are a lot of things they are looking for. So simple anesthesia. You may be a safe anesthetist. You may be a good anesthetist. That doesn't get you a consultant position.
Yes,
JD,
ma'am.
you can tell us about this.
I think Jody just actually joined in, so he may not know what Jashmeet
What
was
we are
asking.
talking about. Okay.
Yeah, but I think that's common thing. I think in UK or Canada, we I think have similar kind of training programs.
Hmm.
Uh, we don't have as many fellowships for outside. Unfortunately, people are joining in. They have MTI scheme, but that's more like using people as workers, basically.
Yeah, yeah.
Mm.
Yeah.
So just to give you a scenario, like for example, the year we had this person, the one whom we've hired, we had 22 fellows.
Mm,
Out of those 22 fellows, one was picked up.
mm,
Okay, so
yeah,
it's not that you cannot be picked up, but you have to be exceptional.
mm, mm,
Okay,
Okay.
with some research capabilities, some sort of So I mean, and in terms of teaching also, I mean, everybody is a very good teacher. That's what I feel. That is not what will get you
mm,
a consultant position.
mm,
Yes.
Fellowship is a different story.
yeah.
Okay.
Okay?
And then there's something called as a practice ready assessment, the PRA pathway, which I
Yeah, yeah, you can
yeah.
do that. That's also very challenging, but yes, you can
Yeah.
do that. Yeah.
Okay.
Okay, so,
Because that's directly for your field, right? Like, then we don't need to do residency again, I guess.
no.
What I okay.
Both routes are very challenging and difficult routes. One route, like I told you, you go into residency, but the only time you can do residency is if you are a Canadian.
Mm,
Yeah. Okay.
Okay. The other route is you get your practice assessed. But
mm,
I
Hmm.
don't know if you can get your practice assessed without actually working in Canada.
mm,
Okay.
I mean, your documents can be evaluated, and the college will tell you, okay, and I have a couple of colleagues who got their practice assessment, and they were told, okay, you need to do 6 more months of whatever, and then you become exam ready. And so then they were eligible to give the
Okay.
exams. Okay.
So they still need to give the exams,
Yeah.
right, Sean?
Yeah.
Yeah.
The
So that
problem
is
also is the eligibility.
yes.
If you come straight from India, you're not even eligible to give the exam.
Mm,
Okay.
yeah. I think there seems to be little similarities between UK and Canada.
I don't
So
think
in
so.
UK there is something called Article 14. So people can actually submit their paperwork. It's huge amount of paperwork, and they can get into a specialist register. So it is called equivalency. But that allows them to
Okay.
apply for consultant jobs directly. So once you're in a specialist register, you can actually apply for consultant jobs. So I think that's what I think practice ready is probably similar to the Article 14, where they go through your documents. So they look at your logs, they look at number of years. In UK, it is you need to have minimum of just 3 years of anesthesia to start applying. But that may not be true for Article 14,
Yeah,
though.
I mean, see, the college rules also keep changing according to the
Yes.
requirement. The friend that I'm telling you about, who was told to do 6 months of residency, she is staff now, but she had done her full MD from India, and then she had worked in UK, and then she came
Mm,
here. So her practice was assessed very, very carefully, and she was told that, you know, whatever, you have this much deficiency in neuro, or you need to do 6 months cardiac, or you need to do 6 months ICU, whatever, so it's a difficult route, but it's doable. People have done it,
yeah.
and then you can do your exams after that.
Yeah,
There
same
are
thing again, Shalini, in UK as well. So for Article
Yeah.
14 thing, when you
hmm,
apply, they will actually look at. So, but then it is your responsibility to arrange that gaps in your thing. So if somebody says that you need to have obstetric experience, then
yeah,
you have
then
to do
then like you 6 months, you have to arrange it for yourself.
it.
They
Yeah,
will not
absolutely.
tell you, okay, go to this center and do 6 months of this.
So you need someone actually who
Okay.
has there to support you as well. And like I said, the group is there, so you can actually find a lot of people who are ready to help you because of the group. if they know you, then it's easier for them to actually then help you out in those kinds. So that way, it is useful. Yeah, and I
So
think
I
yeah. Sorry, Chandi.
no, it's just that the Shiva Chris also has a similar question on practice ready assessment.
Yeah, we can ask
JD,
him. We can ask him to actually join in. Is that Hari Shiva Hari?
it says Shiva
Oh, Shiva
Chris.
Chris. Yeah. Hi, Shiva. Would you like to join and ask the question directly, please? Uh,
Okay, signal isn't
I'll-
great.
yes, some places could be. I think I'll ask him to unmute himself and ask the question.
I know JD is speaking, but we can't hear you, JD.
Oh, I can't. He's in the list, but
No, I see him speaking, but I don't hear him.
yeah, I see him there. Uh,
Yeah, let him fix his stuff. Siva can ask me a question in the meantime.
Good evening, ma'am. I'm Dr. Sivakrishna. Currently, I'm in Delhi.
Okay.
I finished my DM from AIMS in cardiac anesthesia.
Okay, very good, very good.
And then I actually am interested to pursue further opportunities in Canada. So I've applied to your institute also. I'm yet to receive any reply from them for the 2022 year. For 2021, I got selected at Toronto General
Oh,
for a
very good.
fellowship.
Very good, very good.
I thought I could get more insights from you when I got to know that you have been doing this live program.
Yeah.
I mean, what to expect about things there and how the things will be there. And after my fellowship, what will be the opportunities there to continue?
So, okay, every fellowship is different in a way that, like, for example, our Western fellowship means that you have to do service as well. So let us say you are a cardiac anesthesia fellow in our center, you will have to do other things. However, like for example, fellowship in Ottawa, when you are a cardiac fellow, you do just cardiac. So again, it's different from center to center.
Okay. Okay. Regarding the second question, you were just explaining the other person the same thing regarding practice ready assessment.
Practice assessment.
A couple of people I know, like you might also have heard about him. Dr. Tumul Chowdhury is there. He's basically did his DM in neuroanesthesia from AIMS, and now he is an assistant professor there in Winnipeg. He completed this practice ready assessment and wrote the FRCPC exam. Now he is a consultant over there. And there is one more person at your institute itself, I guess, Dr. Sujoy Banik, who you might be knowing him. He has been recently appointed at your institute as an assistant professor. So I've been speaking with him as well.
What's his name?
Dr. Sujoy Banik, ma'am. Dr.
Sujoy,
Sujoy?
yes.
Yeah, yeah,
Sujoy,
yeah,
yes,
yeah,
yes,
yeah.
yes. So with Sujoy, what has happened is that Sujoy hasn't done a practice assessment.
Okay, okay.
Sujoy had joined as a fellow, as a neuro fellow, and obviously the neuro team was quite impressed with his work and his research capabilities, and therefore he was hired.
Okay.
Again, it's so again it's a university to university difference. In our university, what happens is that when you are hired as a consultant or assistant professor, you as an IMG or international medical graduate assistant professor, you will have to uh, get promoted to associate in 6 years time. If that doesn't happen, then your job is gone.
Okay, okay.
Okay. And the promotion actually happens at the university level. It's not a departmental issue. So you have to fulfill all the criteria for the university for promotion, which are the same as whether you are an IMG or you are a Canadian graduate. So you will have to do your research, your education, your teaching, your administration, whatever. And again, every university is different. So Sujoy will have to take that path. In the meantime, if he decides to get his practice assessment done, he could do that. And if they find that it's fine, then he could do his exams.
Okay. Okay. So I mean, I didn't know that part actually. So I thought when I'll come to this meeting, I'll ask you. I mean, this particular practice ready assessment thing, is it available in the Ontario province, or
Yeah,
it's
it is
not there?
available. Actually, it's not an Ontario or Winnipeg or British Columbia thing. It's a college thing, which is
Okay.
countrywide.
Okay.
So,
Okay.
so college will you will have to start an application with the college. It's very onerous.
Okay.
So it is best if you want to start. It takes about at least 1 year to get all the paperwork ready, and the amount of documentation they ask and the amount of details they ask, and then they have to you have to approach your referees and you have to give your case, um,
Okay.
what is the word you use, Shiv? What you've done, so like number of cases or whatever types of
Yeah.
cases.
Logs. Yeah.
So logs, yeah, log is the word. So it's an onerous process, but people have done it, people are doing it.
Okay. Okay. Thank you. Thank you for the input.
Okay, now Dheeraj has a
Jody is there.
question.
Jody is, I think, back. He's reset his thing. I could see him. Jody. Oh, is he? I think he's gone back. Yeah. Dheeraj is one of our faculty. Dheeraj Bhandari is Dheeraj.
Is in Vardha. Okay,
He's in
that's
Varda. Yeah,
good.
yeah.
Okay.
You, who's got connection with Varda? Was it Dheeraj?
Hello. Hello.
Hi, Dheeraj. Yeah, hi.
Hi. Hello.
I
Hello,
can
sir.
put
I'm
your video on. Video as well, please. Let Shalini see you.
hello.
Hello, Dheeraj. Nice
Hello,
meeting
ma'am.
you.
Hello, ma'am. How are you?
Hello.
Hi, Dheeraj.
Hello.
You had
Ask
some.
your question so
Yes,
that
sir.
everybody can hear. Yeah.
I think it was more
Yeah.
of a comment than a question. I think.
No, his
Yes,
question
sir.
is that in many colleges there is no intensive care or critical care. How difficult will it be to cope up with anesthesia postings in Canada?
Hmm.
Basically, like you were talking about the 5 years thing as a rule to come to
No, that
Canada to
is
get a.
residency. That's not fellowship.
Okay. Okay.
Fellowship,
So,
like for example, if you let us say you come as a neuro anesthetist, neuro and anesthesia fellowship, or for example, regional anesthesia fellowship, you will do regional and then you will also do other stuff, but you will not do intensive care or
okay.
critical care.
Okay. Okay. Because
Okay.
I think in Australian pathway and everything, they expect even that if you're into an anesthesia residency or a fellowship, you need to have some exposure to critical
No, no, no,
care,
no, no. I
or
think
emergency
everybody is
medicine,
confusing fellowship
residency.
with residency. So,
Okay.
like for
Okay.
example, in UK, the fellowship, the residency leads to fellowship of the Royal College. Okay,
Okay.
in Australia
Okay.
as well, but not with us.
Okay.
Our
Shalini,
Okay.
I think they're confusing residency because, like, we have junior resident and senior resident in India, and I think US it's also called residency. I
residency.
think that's what I think they're
Yes, sir.
confusing it with.
Yes, sir.
In UK, you need to get onto the training program,
Mm-hmm.
and but one thing is there in UK is that once you are into training program and you have your exams, and obviously that there is yearly assessment paperwork, you are sure to become a consultant. You'll get a consultant job. There is no
Okay.
stopping anyone once you're into a training job.
Okay. Okay.
And it's the same thing here as well. I mean, if you have done your exams, then there is no stopping.
Mm,
But the path to residency is very, very difficult
mm,
because it's very, and I'm sure it's very competitive most of all over the world.
yes.
But for IMGs, if you want to go through residency route, I mean, I don't know. I mean, Jady can tell us what is the
And
situation in his scenario.
Yeah.
In
Please,
our
Jay, please.
department, we have 8 residency spots. Only one is IMG.
Mm,
So 7 are local and one is an IMG. So there is real competition for that one spot.
mm.
But what about you, JD?
can you guys hear me now?
Yeah,
Yes,
yeah,
yes,
yeah.
we can
We
Okay.
hear
were,
you.
know.
Sorry, my computer mic is acting up. I think I switched to the iPhone. That's working fine. Thanks, everyone.
absolutely true, Shalini. What you say is exactly true. So whenever I either candidates coming applying for fellowship and they're looking at long-term settlement, I say fellowship is not a route for long-term settlement in Canada. If you are looking at long-term settlement in Canada, don't come to Canada. Go to US, do a USMLE. Then it is the shortest route. In fact, do a USMLE. Then the Royal College approves your training because US training is approved by the Royal College of Canada. But they still may want you to do additional years because the training program in Canada is 5-year program. The US programs are 3-year program. And then you want to do additional year of fellowship in US, then apply for fellowship in Canada. When I say additional year in US, that takes it into 4-year, but we already do our internship along with the medical school training. That will be considered as another year of training. So now you have queued 5 years of training. Our internship is valid because we did it in WHO certified medical school. Now you can apply to the Royal College of Canada for accrediting your training. Then you can apply for the exams in Canada. You can come to do a fellowship here. It does not carry any value in terms of getting you appointed, but because the Royal College has approved your training and you pass your exam, then you can get a job in Canada. That's the best route to settle in Canada for career. But if you want only short-term training, I think Canada has the best training opportunities compared to anywhere else in the world. I worked in UK as well. I know the training programs there as well. But if you are especially if you're in a highly specialized area like pediatric anesthesia, regional anesthesia, cardiac anesthesia, liver transplant, lung transplant, Canada has one of the best training programs in the world. And you come for a training, it is a very consolidated training. Critical care, again, critical care in Toronto is absolutely a great training. So you can, if you're looking at short-term training, a fellowship is a route. If you're looking at long-term settlement, go to US. If you're thinking of doing residency in Canada, as Shalini mentioned, it's absolutely close to impossible. The market is extremely small. There is only like the whole of Canada, there is probably 120 or 130 residency spots. There is only maybe at the best 5 or 6 given out to IMGs. And even for that IMG positions, there is a big competition, not only from candidates all over the world. Half of them are actually Canadians who did their medical school outside Canada. So they also are considered IMGs. So you're competing with them. So that's what I say. Does it fit in your observation, Shalini?
Yes. So we recently have somebody who actually went to Australia to do his MBBS, Canadian person, then came to USA to do his anesthesia residency. After that, he joined us as a fellow, and therefore his paperwork was complete for exams. So he was exam ready, and he did his exams last year, and he got through. So he is open to work anywhere in Canada now because he's a Canadian. He has Royal College exams, and there is no stopping him. But again, this is a very, very complicated route, but easier than trying to get into residency in Canada because you have to work towards your PR first. You have to be a PR to be able to apply for residency. So that's another two years. So why do you want to waste that much time? First 2 years, get a PR, then get into the fight of getting into 10 positions all over the country. And you know what? All positions are not filled as well. If the person is not adequately trained, the position will go vacant. And a Canadian graduate will be hired on that IMG spot.
So
Can I
actually, sorry. Did you?
Please, sir, go ahead, sir. I was
going to ask whether we can have a little bit of discussion about the exams because we talk about exams. Like in UK, it's primary and final FRCA. And unlike in India, where the exams is like the last part, you done your MD, then you actually go.
And that's
exams
at
is
the
just one
moment, that
part
is
of
what
it.
is in Canada.
Yeah.
There is one written and one oral, and towards the end of the program. But the plan may be changing with the CBD residency. So what is happening is that, like for example, our next year exam people will be doing their exams uh, in their in the last year, but at the beginning of their last year. So, for example, in their final year, in October, they will be doing their written, and then they will keep working for another 6 to 8 months, and then do their orals next year. But there is only one set of exams,
Just one
no
set of
primary, no secondary. But obviously, everybody has to do LMCC, which is primary one, and LMCC 2, which is primary 2. It's not an anesthesia exam, it's like a basic MBBS type of exam. When I came, I also had to do LMCC. So every Canadian, non-Canadian, everybody has to do LMCC.
Right. So this is like FMG kind of exam what they have in US basically.
Probably. I'm not very familiar with
Yeah.
American.
Yeah,
things.
like like in UK, if you want to get into the thing, like they have something called PLAB, but if you want to do anesthesia, then you actually have to sit the primary exam, which is basic sciences.
Yeah.
Once you have your primary exam, then you can actually apply for the registrar jobs. That is the specialist training. And
So
once you
anesthesia, there's only one exam, one written, one oral at the end of your residency,
okay,
towards the end of your residency.
it's like an exit exam then for you.
Yes.
Okay. We don't have that, so you have to do your final FRCA within the first, like second till second year of your specialist training, and then you go on to the higher training. And so once you finish the higher training, then you have completion of the training certification, that's CCT, and you get into the specialist register. That's when you can apply for the consultant job. So there is actually it's almost a 7 year if you are starting off. But it's having primary is like an essential criteria to actually get into the training program.
Yes.
I can.
And even after, yeah, go ahead.
Jody
No,
will.
yeah, I have done the MCC exam, and the Medical Council Canada exam is similar to a ECFMG, the USMLE exams. USMLE step, they don't have the USMLE step 1 here in Canada. They call it MCC EE, which is an evaluation exam, followed by 1 and 2. Both those are similar to USMLE Step 2 CK and Step 2 CS. And the Medical Council of Canada will accept most of their registration bodies will accept USMLE in the place of Medical Council of Canada exam. So if you're done USMLE, you don't need to do the Canadian.
Like I told you,
MCC.
the American person, the person who trained in America, when he came to do his exams here, he didn't have to do all those exams because he'd already done his residency in USA, and all USMLE and everything was done.
Okay.
And because he was a Canadian, he did not have to do TOEFL, because otherwise you have to do an English exam as well.
Yeah. So you don't need the primary, the USMLE Step 1, which is the physiology, pharmacology, that type for the Medical Council of Canada exam. In terms of the anesthesia board exam, it is an exit exam. You have to be trained in Canada to understand the nuances of how to pass that exam. The highest percentage of failure happens in IMGs. It's like a candidate, for example, he's trained in UK or Ireland or Australia, comes to Canada to do a fellowship, and then he decides to stay in Canada. And one of the options is, because his training is from those jurisdictions which are approved by the college to apply for the exam, he gets approved, so he applies for the exam, and then he might have either gone back to UK or Australia and come just directly do the exam. He will fail. Definitely will fail.
Definitely.
You have to sit with those candidates who are doing the exam for at least 3 to 6 months to know the style of presentation. It's not the material, it's not your knowledge base, it's how you present the cases. The exam, as Shalini said, it's two parts. One is the written, and second is the viva part. A viva part is similar to the UK exam when you do your final FRCA viva exam, except that here there are 12 clinical station, and 12 clinical station will have 12 minutes of cases, which will take probably half an hour in UK, but you have to do everything in 12 minutes. So you have to be thorough with your subject, with the no stopping in terms of concerns, consideration, going through the entire scenario without breaking. The examiner usually, if the examiner starts asking you questions, which means you already failed that station. Yeah. He might give additional information about the case, but if he has to interrupt and ask you different questions, that means you're not doing well. So but it's not a difficult exam to pass. It's just that you need to know
Style.
how
You have to be
answer.
trained
The
in that
style
style.
of the presentation is very important. The written part is sort of a little tricky. Written part has got two parts. One is an MCQ part, and the second is what they call as short answer questions. The MCQ part usually comes from previous years, some portions, and some portions are new questions.
I think 10% of question bank is changed every year.
Yeah. So people try to follow the previous year. You found it is one of the toughest MCQs you ever come across in the world, I would say. They make it so difficult. You can't differentiate between 2 and 3. And if you ask so you end up choosing what you feel right, but the answer maybe 3. But if you choose 2, which is what you thought, it's
correct, partially correct.
It's sort of correct. And then you ask the Canadian candidates, no, 3 is the correct because we all decided, we all voted for 3. So some of these answers will have they pick up what the people commonly vote. Then you don't know what is the commonest answer.
The right answer is, yeah.
Yeah,
so it is probably a preset answer.
Yeah. So there is something about the Canadian way of examining that I find it extremely tricky. The hardest thing is I went through this MCC exam and I did the USMLE at the same time. I came out of USMLE exactly knowing where I stand. I passed the exam. When I came out with the same exam, even though when I look back, I scored on the higher end of the scale, but I still, when I came out, I did not know whether I passed the exam. So they make it so tricky that you're completely unsure what you're answering, even though you might be doing well. So that's something tricky with the MCQ. They call it as a short answer question, but it's not like a short answer in India where you write paragraph on a topic. It's usually more like a fill in the blanks, which means that either you know that question or you don't know that question. So if for example, they ask you, what are the 6 or 4 anatomical landmarks for doing a supraclavicular block? Either you know those 4 anatomical landmarks or you don't know them. Or 6 different upper airway anatomy that's different in children. So can be a little tricky. Some of them could be new science materials, or some of them could be very remote material. So it can be a little tricky, but usually you get to the written part, and then you wait for a month or so and to be invited for the oral part. You have to pass both the parts, and you will not know until you pass the exam that where you failed. So that's how the exam runs.
Yeah.
Wonderful, excellent explanation, Jady.
Thank you.
Yeah,
There's a
so I
question
think
from
what
Swati.
the thing is that people better do the USMLE, which a lot of Indian actually doctors do USMLE. So
yeah.
I think if they have a USMLE scores, it'll be easier for them to actually apply for the job.
Definitely, yeah.
So that's actually a good thing, because I think a lot of people probably
Yeah,
weren't aware of this.
yeah.
I think
If they do use it, yeah,
if you want to,
it works in. Yeah, sorry. Go on, Charlie. Sorry.
no, I just said if you want to live in Canada long term, I think, well, the bottom line is probably US is a better route
Yeah,
to come
yeah.
to
It works
Canada to
for
do your
both
exams.
yeah, it works for both the options, right? It allows you to
Stay
bypass
in
the
US
M60.
or come to Canada.
Yeah.
So there's a question from Swati. Is there an age limit for getting fellowship? Technically, no.
Hmm.
Do you want to ask the question, Swati? Anything else?
Swati, do you want to come in?
So,
You can, yeah, you can
yeah,
have your
yes,
video
I
on
think
so that
most of the
Shalini can see you.
questions, yeah, most of the questions have been solved in like last 5 minutes, I think so. Most of the questions were, I mean, I have done my training in India. I did my fellowship in India in regional anesthesia. Then I came to
Where?
Singapore
Where
for,
did you do it? With
I
Ganga?
did it from, yes, Ganga.
Okay.
Then I actually my husband got a job in Singapore, so we are currently in Singapore. And since because there's a lot of restriction in Singapore for doing a job, I have opted for a fellowship. So, but of course, there's similar to Canada. I mean, there's a dead end in Singapore as well. I mean, you cannot do anything further than that if you have a chance to do residency. So all the questions are, I think, surrounded only for the residency part, so that we can actually work and get a good job or consultancy position in any part of the world. So I think most of the questions are answered by you as well as Dr. Srinivasan in detail about the residency. Because I heard somewhere like, there's some age limit or some restriction post MBBS to get either is it residency or fellowship? No, nothing in that sort of.
I don't think even in UK there is actually limit to
Mm.
any age. You can be in
We,
your
we've
50s.
had we've had a few fellows who did their two fellowships and then applied for residency and then did their residency. So people have done all sorts of things. You can do whatever you like, but it's a hard way.
Hmm.
We cannot discriminate people based on the age. It will be against the human rights. It will be a human rights violation. However, they will be when you apply to the especially the University of Toronto fellowship programs. All the academic hospitals in Toronto apply through the same common portal. They will ask you how far away were you from your medical training or anesthesia training. Anything more than 5 years, they will discourage you that you might need to ask your whatever program you're particularly applying to directly contact. Just make sure that they are still taking candidates who are far away. One of the challenges is that further they are difficult it is to go through the rigorous training. The training is tough, especially in some if you are coming for a cardiac anesthesia fellowship or a thoracic fellowship in Toronto General Hospital. You have to be. It is like nearly 24/7 call and long working hours and stuff. If you're not used to that, residency training, and you're far away from your training, people struggle a lot. They discourage people who are far out of their training to apply for the fellowship program. But they cannot say no to you, no for the to apply. But you can apply directly to the program and say this is what my training is, and could you consider me? I'm 5 years out of my training program.
It also depends, if you do get into the training program, it depends on, the person who's covering you or your consultant may be half your age if you are trying to do that at an advanced age. And and I have to say, according to Indian concept, I am the senior person. I have done so much anesthesia in the past. That is very difficult to digest.
It's not about digesting as well. It's actually sometimes actually you feel conflicted
Mhm.
because when I actually came to UK, I had already done, completed senior residency, and there were actually consultants who probably had less experience because at that time in UK, you could become a consultant after 4 years of training, and sometimes it can actually be counterproductive as well at times in that the consultant will think that because you have done 6 years of anesthesia, you actually already know things, but you're working in a different environment. So you need to also be careful of that. I think you need to have, if you're going at a later stage of your life, I think you need to have a very open mind and be
Mm.
very clear. Tell them that yes, I have experience, but not in the same environment as you have. A lot of things were not there in India at that time. We were not even using propofol that time. Sevoflurane probably just had come in. So there were a lot of things which were not there in India when we came to UK. So you have to be very careful about that. There is one question I think from Nikita
I think
Bhattarai. Is pediatric one?
Jady should answer that
Yeah,
question.
yeah, yeah.
Sorry, I
Nikita,
can't see that.
it's in the chat. It's in the chat session.
Okay.
Nikita, are you there?
I don't see her.
My
Maybe on
questions.
a phone, yeah.
I can
We
see
can
the
actually
question.
answer it. This is basically, I think she asked, apply for pediatric anesthesia fellowship at Sick Kids. So Jody, that's for you. But my application was rejected. So wanted to ask, what can we do to have better chances
Sure.
for the fellowship? Yeah.
I can answer that. So the way obviously the application selection is structured is to look at what is the pediatric interest that the person can show either in the CV as well as in the letter of intent. We ask for something called letter of intent, where they are going to explain themselves why they want to do a pediatric anesthesia fellowship, and second, why they want to do it at SickKids. So it's sort of it's a way to sell yourself, your passion for the field, and what you have done so far to get towards that training within your training program. Obviously, you're applying for a fellowship, which means you want to get trained. So we don't expect you already have done significant training, but we want to make sure that you have done electives in your residency wherever it is available, or spent enough time in pediatric anesthesia, accumulated cases, has able to show that that you've done, okay, I've done 200 pediatric cases, of which 10 or 12 are neonates. I experienced this and that. This has interested me, the challenging physiology, pharmacology, and ability to do the wide spectrum of the field. So it's an opportunity for sell yourself why you are passionate about pediatric anesthesia, and also what are you going to do with that fellowship in the long term. That how you're going to use that opportunity. If you're going to say that, no, I'm going to go and like do a general job somewhere, which may not have pediatrics, then you don't. It's a year of fellowship in a high-end institution with exposure to cardiac transplant. You want to show how you're going to use it in your long-term career aspirations. Second is why you want to come to SickKids. Then you want to do some research to look into what SickKids offers in terms of exposure to the field, as well as what else is offering. We have a heavy research program, which means that the fellowship candidates get 1 day of research every week. So you want to have some concrete idea of how you're going to use your research time, and what are the questions, investigative questions you want to explore during that time. So
I'm
those
just
two are
excusing myself for a minute.
Yeah. So those two questions need to be addressed in your letter of intent. Second is your CV. So the CV should be competitive one, in the sense that you look at your cohort of people who are applying to this PEATS fellowship. We have Canadians all across from Canada applying. because this is one of the largest center, and it's one of the largest center in the world in terms of open. It's all open to uh, every candidate across the world without any restriction. We don't ask for a USMLE. We don't ask for any specialized exam. You have to have an English certifying exam done, which is either TOEFL or IELTS, to make sure that your communication skills are good. But outside that, if you're done 5 years of anesthesia training, you passed your training in your own country, and you have built a CV, and you have shown adequate passion, you should be able to apply. When we look at candidates, we also look at what they have achieved in education as well as in their research side. So that's how they get scored. If your score is less than, we usually get around 100 applications for the 10 positions we offer. Most of the candidates don't score well on the research side as well as in the academic front. If you haven't shown in a CV what else other than your anesthesia training you have accomplished, you're going to score low and you won't get shortlisted. So use your time before you apply to improve your scores on those fronts. Very often it may be just a simple case presentation or doing an audit within your department on certain practices. The commonest one people do is like, I looked at the last 100 cases of strabismus surgery on their post-operative pain or nausea vomiting score, and I presented to the department. These are the suggestions. Based on these findings, we suggested these things and we made these improvements. And that would be a nice paragraph for your research part of the CV. For your education and managerial side of the CV, you can talk about, you helped in making the rota for the junior trainees. So you have to show that in your CV and you have to score points in those things so that you will get shortlisted. Once you get shortlisted, then you go through an interview process. The interviews are fairly straightforward. It is not a complicated interviews like in UK's situation. We ask very set up a not even clinical questions. It's more like understanding whether you understand the Canadian system of training and whether you'll be a good fit here, whether your communication skills are good. So those are how we get candidates selected and shortlisted. There's nothing that bars any candidates from anywhere in the world to. We have candidates from all over the world. Right now, we have candidate from Peru. We are expecting a candidate from Delhi, who should be here, who've been delayed a little bit because of the COVID and the embassy closures. We have candidates across from Italy. We have Japan, Australia, UK. So we have candidates from every part of the world. 2 Colombians. So your training does not discriminate you from not getting a fellowship in any of the institutes. At least I can speak for the University of Toronto institutes. It's just how competitive is that particular year and how you're able to frame your CV as well as your letter of intent in a positive way to get a shortlisting.
Yeah, so you basically, I think out of the 100 applications, 10 are, so 90 people wouldn't have got shortlisted for it. So it's not a bad thing, but I think you can always improve for the next year, isn't it?
Yeah.
Another thing I would like to add in your application is, what I get people who have not even done their homework. I interviewed a candidate who actually thought that we are in London, Canada, in London, UK. Even though my city is called London, it's in Canada. Are you even sure which country you're applying to?
What are you applying for? Yeah.
Okay. The other thing is you have to spend some time on your resume. The CV has spelling errors, grammatical errors. I mean, really? At this level of your life, your resume has grammatical errors and spelling errors? Anybody who, and people write text language in their resume. You, like
Wow.
you, and I actually don't even invite those people.
Yeah.
Those get junked.
Hmm.
No, if you haven't spent 10 minutes or 15 minutes on your resume checking everything, then I think you are not worth it.
Yeah. I think there is so much of help available on the group. People can always, ask somebody to check their CVs. I get few CVs to actually check and format them and look at them. But I think, yeah, using the SMS language or that is not done. You need to be actually with a CV is
You
like
have
an
to have
official.
formal
Yeah,
English.
it's a formal document. Yeah,
Yeah.
you can't be lax about what language you use in your CV. And there is a format to most CVs.
Yeah.
I think therefore, I think the thing which message to take from Jody's answer to the question, uh, when they say about research, it does not actually need to be a big research thing
Yeah.
published, not a randomized controlled trial. It could be an audit project, something very
Yeah.
sensible, something which you have presented, or it could be, we call it QIP, Quality Improvement Program,
Yeah.
or project. Sorry, it's more of a project, quality improvement project where you do an audit and implement it, and then probably re-audit to complete the audit cycle.
Yeah.
Uh, and for academics, it could be presenting, a poster presentation, or uh, teaching or taking classes, or whatever
Yeah.
for PGs or even for undergraduates.
Yeah.
Everything need to be on the CV.
Yeah, I think it's the tendency people are looking at.
Yeah.
They want to see what
Mm.
what do you have the tendency to do research?
Yeah, yeah, absolutely. Yeah. And I think just because you have done thesis as part of MD does not mean that you have actually done a research. You need to actually go beyond that.
Absolutely, Shiv. That's the thing as well. People miss is that they have an opportunity to use that MD to publish in a journal, is right? That they have done the work already. What stopped you from publishing it? So yeah, any presentation in a national conference, even a case presentation, or the audit program which you did, quality improvement program you did, whether you can take it to the next level and present it in a conference as an abstract, or even e-poster, anything will count towards scoring points in that. Obviously, if you have done a randomized control research and you published in a big
Nothing
journal,
like
that
it.
carries a lot of weightage, but you don't need to. But you have to fill in that box. If you haven't, again, another candidate is going ahead of you.
The other thing in your CV I would like to mention is that when you mention referees, do talk to them.
Yeah.
Do talk
Yeah.
to them. Because, I've had applications where people have mentioned their referees. Referees have no clue that the person is applying for this position. And obviously they will give a reference letter, but it's not going to be in golden words. You didn't even tell the referee that you were applying.
I think rule
So
for that is that you need to have consent of your referee to be putting in your CV.
yeah,
You just don't put anybody's name
anybody's
in a
name.
CV. You need to actually have that, and always send a copy of your CV to your referee.
Yeah.
Let them actually
And
have an idea of what you are or
take their
what you have
permission
done.
that I want
Yeah,
to put you as a referee. Would you
yeah.
be willing to write? And because I've also had some referees refuse. No, I'm not
Mm.
interested in writing a referee.
Mm-hmm.
Why did you use that one?
Yeah, that obviously means that you did not take a consent from that particular referee, because as far as GMC is concerned here, if you are actually agreed to be a referee, you cannot actually give a bad reference.
Yeah.
That is actually a rule. It's part of the good medical practice. So you do not agree to actually be a referee unless you actually know the person and you can vouch for that person. So that is also part of our learning. It's not just for candidates, but also for people who are going to be referees for the candidates. We have Nabnita, Nabnita Das. And Nabnita, you want to come in and ask your question?
And after that, it'll be Jeshua.
Yes, yes, there is Joshua as well. Yeah, yeah. I think Jeshnu was actually before Navneeta. So we can ask Jeshnu Chobe to actually join us first then. Is this?
Yes, sir. Thank you.
Yes,
Thank you.
Jeshnu. Yeah. Jeshnu. Yeah. Go on.
Yes, sir. I am myself
Okay, you can
working.
have your video on. You can interact with us. It's fine. Yeah.
Yes, is it?
Yes, you are.
Yeah, thank you, sir. Actually, I have done my anesthesia training, first diploma in anesthesia and then DNB in India. And after that, I worked for some for a couple of years here as anesthetist, and then I have done my fellowship in intervention pain medicine.
From
And
where?
From Daradia Pain Hospital, in India itself, from Daradia Pain
Okay.
Hospital, Kolkata, under Dr.
Okay.
Gautam Das.
Okay.
And
Dr. Gautam Das is quite a well-known intervention
Well-known person. Yeah, I've
specialist.
heard of him.
Yes.
yes, and now I'm looking for a change to Canada. And recently, ma'am, I have got a job opportunity from Halifax. For they have an opening for a PMU for 12-month fellowship, and I have no clue how to go ahead. Whether it will be helpful for me to get settled in Canada or for long term. I don't know.
I think you joined the discussion a little bit late. We did talk about it.
Yes, sorry, ma'am.
Fellowship, yeah, no, that's okay. Fellowship is fine, but fellowship is not the route to stay in Canada. I mean, you can still stay in Canada. You won't be able to work as a physician in Canada.
Okay. So,
Okay.
is there any way, by any chance, I can directly enter as a pain specialist over there?
No, no. You have to be college certified, and there are different ways to do a college certification. Uh, it could be like we talked about earlier, you have to either get a practice assessment done, and in the practice assessment, they can tell you, okay, no, it's not, your residency is not complete, you need to do 1 year, you need to do 2 more years, or whatever. Or they might say, okay, yes, you are practice, you are exam eligible, you can do your exams, or you are practice assessed. There is no way that I know of that you can get a direct entry into a consultant position from India without doing anything.
Thank you.
I agree. I
Correct,
touch up.
Jady?
Yeah, correct. I mean, candidates need to realize that there are different bodies. There is a regulating body that allows you to practice. Many of these regulating bodies are not educating bodies. For example, if you're in the Nova School, when you talk about Halifax, and you talk about a Halifax fellowship in pain medicine, which means that particular institute is applied through the local university with a regulating body to allow 1 year of training for candidates from elsewhere. So that's all it is. Now you're thinking that I want to settle in Canada. Then the regulating body will say that you need a permanent registration with our regulating body. You can get it if you are trained in Canada. Your fellowship is not considered as training for that purposes. You have, when they say training, it means you have done your residency in Canada. Or if the educating body, which oversees all education in Canada, called the Royal College in Canada, which sees everything, including anesthesia, medicine, cardiology, everything, that has to look at your training and say that, yes, you can apply to us to get your training exam certified. In Indian context, it doesn't, because our training is not approved by the Royal College there. So in a catch-22 situation, even if an employer is willing to give you a job long-term, he can give it only if you can get the regulatory body to approve your position. The regulating body will ask the Royal College to see if your training is valid. The Royal College will say, no, your training is not valid. So in a catch-22 situation, even if you have a job, you will not be able to practice medicine because you haven't, according to the Royal College, you haven't done your right training. So we talked about this before you came on. We said that if you're looking at long-term settlement in especially in a bigger center, in a remote places, they might agree with some. After trying for a few years, you might find a place where they will take you and they will maybe able to convince the local regulating bodies, can you give us this candidate a job for 3 years? We will have a supervisor nominated, and then after 3 years, we can reassess his practice and then apply him permanently. But these are all it's sort of a lottery thing. You take your chances and struggle through it for a few years. And remote parts of Canada are not friendly for our tropical weather people.
Remote parts means it's not
very,
remote
very
like
tough.
India that it's a village. A remote part means minus 40, minus 50 degrees centigrade for most part of the year. There is absolutely no life.
Yeah.
So
you're not doing what you trained for. You're not living what you thought you'd be living for. So it has to be a separate gene in you to attract you to those remote parts to survive in those. So it's not for everybody. So I wouldn't bet on it to do that sort of a taking chances. So as we were saying before, if you're looking at it as a long term, yes, you can come and do your fellowship, and then you get a feel of what is required, and then you might need to do a USMLE, do your training again in US, and then come back to Canada.
Thank you, sir.
Nabanita, I think Nabanita now.
Yeah, Navnita would, I messaged her that she can come in. Navnita, you can turn on your video and audio. Just that's reminding me, I was talking to one of my friends who's a senior consultant in intensive care here in Liverpool. So he did his fellowship in intensive care from Toronto, and we were just discussing. So one thing he said was, when he actually went there, I think it was peak of winters. He said he really hated it, but as things got better, and he loved it. And he said when he was actually leaving Canada, he sat on the lounge in the airport and cried because he was leaving Canada. And he was just telling me, this is just a few days ago, and he said maybe I once a while think maybe I made a mistake because they did offer him a job. He said maybe he should have stayed back. So I think people do
absolutely. If you have stayed in Toronto for a couple of years, you would not leave Toronto. I mean, it's a lot of things that is extremely positive about it, even though we suffer long periods of winter. But you get used to it, and then we stop thinking about it. It's minus 17 outside behind me.
Yeah, but Jady, it's not like remote parts of Canada.
It is not. No.
minus 30.
Yeah. No, but the other thing that goes, I mean, that's because you are in Toronto or in a big center, London, Ontario, or Vancouver. You can get your own culture. You can.
It's very good social life.
Social networking. But if you are anywhere outside these sort of area, you will not see similar people of your own color to talk to and interact. Getting your own type of vegetables and food will be completely different, completely difficult. Like you might need to travel, like take a flight to get to an Indian restaurant. So it's, whereas in Toronto, you can, I have like 10 minutes, I can go to Anjapur or Saravana Bhavan, like it's not a, yeah.
Yeah, that is important part.
Yeah, when we are in the first year, every weekend we used to go to Anjapur to get our South Indian thali and sort of. So food. I mean, we all. I mean, India, we love food, is right. Like when you can't take the food away from us, and
can't survive without Indian food. That's the thing. Yeah. That's the bottom line.
So yes, if you are in any of these big city, you would enjoy it, and people. Many of these the hospital, it's about like the love of the place, love of the work you do, the education system, the way of life, treating equally, respectfully. racism will be there, but it's extremely low compared to any other countries I've come across. So it's welcoming. It's a land of immigrants, so, and it is truly a land of immigrants. And when you're working in the operating room, you can identify every race in the world. Like maybe a Chinese surgeon and a Japanese assistants who's helping out, and then you have Chinese from all over the world. The nurses, they are Canadian, but you can see from the ethnic mix that one is a Filipino, another is an Indian. So you have all races there and in the room, and everybody feels Canadian, even if they're coming here just for a year. There's no differences just based on your race. So they work very well together. The education system is absolutely fantastic, and it's a great country to live in. So people do miss it, even if they come for a short term. They do miss it. Yeah.
Okay, Navnita, you can come in now. You there? I think
Yes,
you
sir.
have your audio and video on.
Yes, sir.
Yeah, go on.
Yes, sir. Sir, I'm an Indian medical graduate. I done MD in anesthesia. So as I heard that going Canada as a foreign medical graduate and settling there is nearly impossible. So is it so? If I want to settle in Canada, so is it nearly impossible for me? What are the exams I can go for? I'm sorry.
There is nothing called impossible, is it?
No,
You
Yes,
can
sir.
make
see,
impossible possible.
I will start the discussion and Jady can take over. Nobody is stopping you from settling in Canada. You can take immigration, come here and settle. The problem is the job.
Yes,
Okay.
ma'am. That's what I'm asking. That getting a job or getting into the
A job
training
in which
system,
you are
is it?
qualified for. I mean, you can still get a
Yes.
job, but a job in which you are qualified for. That is the whole topic of discussion for this meeting. We've been going on for over an hour now.
Um,
You have to work for
okay.
it. The question is that you need to work for a job. You need to
Yes.
decide what job you do. You need to work for it. Nobody is going to give you on a platter. It's like, come, Navnita, here is a job for you. Come and join. Okay. Well, it did happen.
No,
It did happen to some of us in UK. But I don't think that is the competition
I'm
was
going.
increased.
I'm going to ask a few questions to Nabita. How long? What is your? What are the training you've done so far? You've done an anesthesia residency, I assume.
Yes, sir. I had done my anesthesia residency. I had
Okay.
done my diploma in anesthesia at first for 2 years, and after that, MD in anesthesia.
Okay.
And it is I had 3 years post MD experience.
So
So
you've
you
done
have
6
nearly
years of
5 years, isn't it?
um,
2 or 3 years of DNB and 3 years of MD. So
okay.
that's 6 years now.
Okay.
Yes, yes, sir.
Okay. Have you specialized in any particular area?
No, sir. A
Okay.
subspecialty you were asking, right?
Yeah.
No, sir.
Okay. Why do you want to come to Canada?
Sorry, sir.
Why do you want to come to Canada?
Sir, I want to get into the training system in the Canada, and after that, I want to settle there.
Okay.
So,
Are you looking at when you say training system, are you looking at a residency program? Are you willing to go through another 5 years of training?
sir, I don't mind to go into the another 5 years of training.
Okay.
It'll probably be
All right.
more than 5 years, Jady, because she has to become a PR first.
Yeah, that's right. Probably people from India, they can apply for PR there itself, is right. They will probably get a PR based on their income and education criteria.
Yeah.
So getting a PR is not would be
It
will
will
take some.
take time. It will be at least
It
1
will
year.
take time, but you may be able to get the PR. So Nabita, this is a situation that every year, Canada is a vast country, but it's sparsely populated. There's only 35 million people in Canada. They have only probably 100 to 120 residency positions. And 90% of these positions are reserved for Canadians. Only 10% are given out to IMG people. And for every IMG, one position, there's probably 100 applicants. Who are these IMGs? Half of them are actually Canadians who left Canada because they could not get into medicine in Canada. They left either to Ireland, UK,
Caribbean.
Poland, Russia, to India, Caribbean, US. So they all want to come back to Canada to do their residency. And they all, because they're Canadians, they have that advantage. But they are still considered IMGs because for the medical school, they left Canada. So they are going to be extremely competitive there. And then the rest is all other people from all over the world applying for residency position as well. So it's an extremely slim chance that you would be able to get into residency in Canada. So we were talking about this before. Our suggestion for people who are looking at long-term settlement, because of this, you could come and try it, but you will end up wasting 3, 4 years, 5 years. Whereas you could have spent the same number of years in a different route, where we would suggest that you apply for your PR from India, you do your USMLE, you apply to US to get your anesthesia residency done, spend an extra 1 or 2 years of fellowship in US, and then apply to Canada. Now, your US training allows you to write the Canadian Royal College exam directly, and also will provide you job opportunities across Canada. That's probably the best route.
Okay, sir. Okay, thank you, sir.
I think the bottom line again here is that yes, you can actually go anywhere you like. You need to actually have that conviction. You need to actually work hard for it. And I think there are people who can guide you if you have decided to actually move somewhere. There are people to guide you.
I want to mention something, Shiv. We get a lot of candidates from Middle East, and not necessarily we. I mean, the whole of the fellowship programs gets candidates from Middle East. They're usually in their 50s, mid 50s, who essentially the kids have grown out. They probably exhausted opportunities in the Middle East. Either they go back to India or for college education, or they apply to Canada. Canada is welcoming. So there are a lot of their kids maybe in the Canadian colleges, and because they want to come along with their kids, they apply for fellowship program, because that's the only direct entry to come to Canada for them. And they end up, if they can't find a fellowship, they have a PR, they end up taking jobs, any jobs. They may be working in restaurants, they may be driving cabs. So you will find a lot of actually doctors driving cabs in Toronto, because there is no way you can be a doctor without going through all this process. So without knowing this, they end up, like, I have a PR, I may be able to get a job. No, it is next to impossible to get a job.
You can get a job, but at McDonald's or in Tim Hortons, yes. But
not as a doctor.
Yeah, that's what I think Shalini said at the very beginning, that they have one of the most qualified taxi drivers in
the world.
Oh, okay.
In the world.
I missed that part.
She actually did start off, I think, with that. I think that's difference. That's what I think causes, I think, confusion amongst people. It's different in UK. It's different for US and Canada or Australia.
There are a lot of.
There is actually a question for me, but the person hasn't identified himself or herself. It just says iPhone, and that person is not on there. So UK is, I think, very straightforward in that way.
Yes.
So why don't we ask this iPhone person to unmute?
I did message, but I think that person has not, got that.
That's fine.
People are coming. There are actually lots of. I'm going to tell this frankly. These are donkey jobs, right?
Hello, sir.
Hello.
Sir?
Yes. Hello.
So this is Dr. Ronak over here, if you know me.
I don't know. Were you the iPhone guy?
Yeah, I'm the one.
I don't know. Okay, okay. Yeah. So yes, let's talk about UK then. So
Yes.
tell us how you actually landed up in UK so that people know how you
So
did that. Yeah.
first of all, sir, big thank you for doing this for all of us here.
No, you're welcome.
That too also on a weekend.
Mm.
Anyway, sir, so the thing is, I did my MBBS, my MD from India, then 3 years senior residency. Following that, I qualified the European diploma exam, got my GMC registration. Now I'm in UK for the past 2 months. That's it.
Oh, that's. Did you come through the MTI scheme?
No, sir. I
So you applied
got
directly for a fellowship job?
sir, as a specialty doctor.
Yes, that's right. So there are actually now, if you're coming to UK, so you either come through MTI, that is through the Royal College, and these are basically donkey jobs. So there are gaps in training. They want people to man the rota. So they employ people from India is the biggest supplier of doctors.
Yeah.
Okay. Qualified doctors and very good doctors. The greatest advantage Indians have that they speak English. They have been trained in this system, which actually is in English. Okay, so that is their biggest advantage. And obviously, Indians are pretty hardworking. They're qualified. They're skilled, so they fit in very well.
Yes, sir.
The other is the specialist doctors, or trust grade we used to call them.
Yes.
Okay, so these are all called non-training grades.
Yes, I'm one of them actually.
Yeah,
Right.
yeah. So all this, whether you're coming on an MTI, you're coming as the trust specialist, you're coming as trust registrar. They're given different names, even trust fellows. So all these are the names. Okay. So what is the next step? So people who have done EDIC, okay, it's good for that because they can actually get their GMC registration. Right. So that is the biggest advantage of it. You can also get exemption of actually not doing your primary, but if you want to stay back and get into training, then it's important that you actually have your primary exam. If you
Yes,
want
sir.
to
About this particular issue, I have a
Yes.
question, sir. Is it like before I get into an ST3 post, I have to have at least 24 months of GMC experience? Is it an absolute requirement?
No, that is not actually true. You need to actually just be in UK for 24 months.
Apart from that, you need 24 months of post GMC experience on
Okay.
the ST3 website. I wanted someone to confirm that to me. So I thought you are the best person for it.
Doesn't actually, well, I wouldn't say that I'm the best person because I don't decide on these rules or have that kind, because previously it wasn't, but it does not prevent you from applying. Okay, so if you're actually saying that, even if they say that, oh, you need 24 months of anesthesia in India, sorry, in UK, uh, okay, you can apply. The worst, what will happen, they will reject it, right? Yeah, you can apply next year and they will accept that if it is within the time frame and then you'll be completing your 24 months of training, they will still accept you.
Okay.
Yeah. So it does not mean that you actually have to have finished those 24 months if the rules say so.
And apart from that, sir, what else do I need to strengthen my CV?
Yes. So like I said, the CVs and things like that, you need to, here the application is on the net, so it does not actually apply. You obviously have your CV for other things. Everything is on the net. It is very simple. You need to actually have got your exams. Once you have, during this time, you can actually do your audit projects, get involved with some audit project where you can actually do presentations within the department. So getting into the training job is also hard work, but also a bit of luck as well.
Yes, sir.
It's all centralized. Okay, so you'll be assessed, and obviously there are the number of jobs, the huge number of jobs.
So I have. Can I ask you another question? Can I interrupt you there?
No
a moment,
problem.
sir?
No problem at all.
So actually, me and my wife both are anesthetists, both are
Yeah.
in the specialty doctor post.
Yeah.
Is it possible for us as couples to get into a training position in the same deanery?
No. That
That's
is the thing with the West. That is the thing in the West. Okay. That they do not, it's not like India, just because you're there together, you can be lucky. So what you can do is you apply for the jobs, right? And after you actually get a job, you can actually apply for interdeanery transfers.
okay. Okay.
So don't think that you will actually at the beginning itself get, both of you get, one of you might actually have to travel, okay, or may have to stay separately and only be able to meet on weekends and that kind of thing. But you can always apply for interdeanery transfers. Okay, that is actually allowed.
Yeah.
Yeah. And then you have to look at a bigger picture. Like I said, I was mentioning before, in the UK system, once you are in the training program, you complete it, you do your final fellowship, right? Complete your, the ST7.
Yeah.
And nobody can stop you from applying for a consultant job or getting a consultant job.
Okay, sir.
Yeah, that is sure shot. Okay.
Mm-hmm.
Yeah. And then
Okay.
as a consultant, you're free to actually apply anyway. And even if you actually get, again, consultant job, again, does not mean that you have to stay in one place. After a year, you can move to another place.
Yeah.
Or if you're in two different cities, you can actually, then I mean, whether it's you or your wife, they can actually move to
Yeah.
a
Over the
one
past
outside.
couple of months, we have been, looking whether it's possible to, as a couples, that we can get in the same deanery or not. We have been asking around a lot, actually.
Yeah.
Then I thought, why not join this meeting and ask you directly?
Yeah, like I said, look at bigger picture. Don't think of the short terms. You might actually have to. I think the training program, you have to actually accept that it is, well, it's very structured, right? Your working hours are fixed. You will have to do on calls. Okay, and if you're happy to actually travel a bit, that's something not a bad deal, because in the end, you can, when you come to a consultant level job, which you are now allowed to apply 6 months before you complete your training.
Okay.
Yeah, so that's it. So one step at a time. First thing is do prepare, get your primary. Even if you are told that you are exempt from EDIC, don't take it on. People will actually give you all kind of advice. But if
Yeah,
you
they
want to actually
told me
go
that,
to
but
training program,
yeah, I
if you
did my
want this,
research. I did my research, and I was, I found out that primary is absolutely required.
yes.
Now I regret my decision to go with EDAC at the first time. I should have
No,
given the
no, no,
primary.
not at all. That is never. No exam is a regret. Okay.
Yeah, that's true.
It is actually would have prepared you for further exams. One thing, and when
Yeah,
you start revising, things will come back, so you'll find it easier. One thing. Second thing, it's actually additional degree. When you go for your consultant job, you say, I also have this degree.
okay.
Okay,
Okay.
so that is actually a positive on your CV. So
Okay.
never actually think that you have done something which is not required. It's fine.
Yeah,
But
because
like
the
I said,
past 2 years I was senior resident at AIMS Delhi, sir.
yeah.
And there I thought I have wasted 2 years on EDAC when I could have done
No,
the primary
No,
at
no,
the
no,
first.
no, no, not at
When
no,
all.
I
no,
found
I
out
don't
that
think
you
it's
have
a
to do the
waste
primary
at
anyway.
all.
Mm-hmm.
Ronak,
Shalini
I
and
would also
myself both
like to
are from a.
comment. Yeah, I would like to just comment on your situation. I know a lot of couples, and we are a couple who are both anesthetists.
Oh, yes. Is
What
that so?
we've done, yeah, what we did in our past, and I will speak from experience, we actually staggered our training. So one
Okay.
person got in first, the other person got in about a year later. So by the time everything got stabilized, your house was settled. I don't know if you have children or not.
No, we haven't actually. We have to have that.
Yeah. So if you have
Now,
children, then
it's
Only.
then
almost
that
3 years
portion.
of my marriage, and people are pressuring me into it. And our trainings. That's what
So staggering is not a bad thing.
Okay.
So one
Okay.
person goes in first, could be any one of you, and the other person goes in about 6 months or 1 year later, when things are a little bit settled. You know what things are happening, what you need, and I know a lot of couples who were weekend couples during their training program.
Yeah.
So I mean, it's doable, truly
Yeah.
speaking.
Yeah.
Yeah,
I think
thankfully for now, we have the job at the same hospital. We are, sir, at Northeast in
yeah,
Stockton
yeah,
right now. So we found this job at the same position at the same hospital, I mean. But looking at things ahead,
yeah.
it would be a bit of
Yeah,
a
Ronak,
cheaper.
like I said, these jobs are easy come. Okay, they are actually basically using for donkey work to fill rotas. This is not a training job, but
Yeah,
that does not mean that they will, if you actually speak to your college tutor, they would actually allow you to go for your teaching things. Obviously, this is COVID time. There's probably not much teaching and stuff, but you need to sit down with your college tutors and explain to them what is your requirements, what you want to do, like for especially for the exam purposes, how do you need to prepare for it. Now there are issues with exams as well because they're now being done on the web. Okay, so they're not face to face. I don't know when they will start. So they are limited by, there is a big backlog of candidates who have
yeah,
actually passed their theory part and waiting to do their practicals or the OSCEs.
yeah,
So you need to actually prepare, speak to your college tutor, explain to them, speak to people around you who are giving the exams, and start preparing for your primary, because that is the first thing. You already here, you already crossed the first hurdle. Okay,
yeah.
yeah. So start preparing for your primary exam. Get
Yes,
that in your pocket. Okay,
yes,
you be there. So when you actually apply for your ST3 job, you say that I have got my primary and I have got my ADIC as well. So that ADIC is not going to go waste.
okay, yes, sir.
Yeah. Okay. And like I said, don't think of short terms. Think of a bigger picture.
Yeah,
You might be limited by things like your visa and stuff. So
yeah,
you need to actually have a clear, time frame. So you need to say that I need to get my primary within this time frame. I need to
yeah,
apply for my ST3 by this time. Okay. And people actually apply for jobs, and if they're not actually select, don't worry about it. Failure is part and parcel of this system.
yes. So I have failed quite a times, quite a
Exactly.
lot.
Yeah, yeah, exactly. Every time you fail, you learn something new. Okay. Yeah.
Yeah.
So there are people, like I said, there are people around who will be able to guide you around. So best of luck.
Yeah.
Thank you so much, sir. Thank you so much
And
for talking.
again, Ronak, it's very, very doable.
Thank you, ma'am.
At this time, you might think, oh my God, we have to live separately. Oh my God, we have recently been married. It's very doable. And 5 years from now, you will think that it was a good step.
Yeah, yeah.
Okay.
Definitely. Thank you, ma'am. Thank you, ma'am, for talking it out.
I think Arun Raja,
Yeah.
he too actually had a similar, I think, query. Arun,
Hello,
I think,
sir.
did you get your answer?
Uh, uh, no, sir. Actually, after India, can I directly apply for a fellowship in UK? That was my question.
What fellowship? That's why they say you need to be very
Yeah.
clear. We're talking about what fellowship are you talking about? So
Yeah,
now
that is
even the training, the FRCA is a fellowship, right?
okay.
Are you
Uh,
talking about doing the FRCA exam, or are you talking about fellowship in anesthesia, fellowship, sorry, in intensive care or pain management? What are you talking? What is the thing?
yes, sir. Like training in subspecialty, I'm talking. Like,
Yeah, yeah. There is nothing like that separately in UK.
okay,
You need to be in the main training program
okay,
to be specialized. So during this training program, you can then get higher specialist training,
okay,
right? There are some fellowships where you might actually be able to come for as, like I think Canada and Australia are probably better places for those kind of fellowships,
But I
because
think even one of our Australian fellows, she
yeah,
went on to UK to do a fellowship, 1 year fellowship training
yeah,
uh,
yeah,
in subspecialty. But that's a different fellowship. It's not
it's
got nothing to do with exams.
yeah. And those kind of fellowships, like again, I was telling you that there are non-training jobs which they call fellowship. Okay, these are actually basically just doing donkey work.
okay. I understand.
Yeah, yeah. So they will say clinical fellow in anesthesia. Clinical fellow for anesthesia. Basically, you are just a worker there. Okay, you will be just working as a anesthetist for them,
Okay.
doing on calls, doing theaters. Okay, there won't be any structure teaching, nothing like that. So that's one. Now there are some fellowships like in cardiac anesthesia, neuroanesthesia. There are some pain fellowships. Now these are far and few. That means there is quite a lot of competition.
Okay.
And you can apply for them, do for a year, and come back. That's one thing. If you want to do your FRCA, you can go. EDIC is, like I said, you're exempt from primary. So, but you need to be working for at least 12 months in UK to be able to actually give your final FRCA. They will not allow you to actually give your final FRCA directly, even if you're exempted. You need to have worked for a year within the system, and then you can apply for your final FRCA.
Yes.
Yeah.
I get it. Yeah.
You got it now. Okay. Good. Good.
Thank you.
There's a question from AJ. We have talked about it before, but I will just repeat it. His question is, FRCA and UK training valid in Canada to gain the Royal College? Is AJ somewhere?
He's not on the thing
No.
now, but he can answer it, Shalini. I think he
Yeah, but I can still answer it. You can it's not valid. You can get your degree assessed and do the exam. But you cannot do an FRCA and come straight to Canada and start working as a consultant. No.
So let me put, because like Jody has done, or there are some other people who have actually done their completed their training from UK, got their CCT, so they can very well be consultants in UK, but they still went to Canada and did their exams. So what exam are we talking about here? I think that's the question.
Yeah.
Sure, I can cover. So the Canadian Royal College, which administers all the exams, looks at for the anesthesia specialty, looks at where you did your training and whether that was a complete training. So if for in the context of UK candidates, they want to see that they completed the training program in UK, which means that you've done all your specialist training in UK. And the program director from UK has to certify and fill up a form that you completed all your training. If you have that completed, then the Royal College of Canada will allow you to sit for the FRCPC exam in anesthesia board in Canada. So that's then you get certified in anesthesia for Canada. That does not give you any job. This is just an examination body that certifies it. You have to find a job on your own. And then if you find a job, you have the Canadian board, and then you apply for the regulating body to give you a license to practice. The regulating body will look at your, okay, you got FRCPC in anesthesia, but you don't have a primary medical exam clearance. That's where you have to either USMLE or MCC exam.
Yeah, so it is like General Medical Council in UK, which is your, basically the only GMC looks at your primary degree.
Yeah.
And then you have a specialist register, which is actually for the specialization. So there is a specialist register for anesthesia, specialist register for medicine, specialist register for surgery. So that is what the specialist register is. It just says that you have completed your training in particular area. But basic, like your basic degree, like MBBS, is what the GMC looks at. That have you got it from a college which is approved by the WHO?
Hello?
Yeah. Hello. Yes. Who is that? Hello. I think that was just somebody had not unmuted their phone.
Shiv, I just want to follow up. There are a lot of UK is a lot of UFT direct appointment from candidates who came here from UK for training. It's a very common route. UK candidates becoming consultant after a year of fellowship in Toronto is a very common. So it's the reason that's common because either they do go through the exam route. There is also if they are academically gifted and have a lot of research work. I think Shalini covered this before, I believe. They can convince the local department there will be a great consultant hire for them, because they can get the academic mandate or the research mandate. They will be applied through, they will be exempted from even doing the exam through a university pathway. So university will appoint them directly as assistant professors, and that will allow the regulating body to give a license.
Yeah, that would be an academic license?
It's in an academic license. It is a restricted license to that particular hospital and the particular university. It is an academic license.
So basically what it means is that they can't move, they can only do the job, that particular job.
So they are attached to that particular university and the relative hospital.
Yeah. If they don't want to stay in the academic pathway, they can, because they did their training, completed their training from UK, they can apply, as I said, they can apply to the Royal College of Canada to get the exam route. And usually the regulating body gives like 3 years of time for you to complete all the exams. And then you can get an independent license and you can move across anywhere, any hospital, anywhere across country. But that route is sort of narrower because it requires that type. That department is looking for that type of candidates that they need who have come with a high research skills or educational skills. So it's very limited, but it's a very attractive option for some hospitals.
Yeah, we've had quite a few of those appointments directly from UK. They came and did 1 year fellowship, and we found them to be very, very good, and they were hired directly.
We have a lot of candidates from here as well. Shalini is right. Vishma is through that sort of a similar route. Nivedita, who even it's slightly exceptional that she was able to get an appointment, even though she did not have a UK training. Or
so and I talked about her right from the beginning that the department found her very, very good.
Yeah, those are uncommon situation, and I don't want people to believe that it's possible all the time. What Nivedita or Vishma had, they were hardworking, exceptionally good candidates that they were able to convince the department to offer them in academic positions. But that's will not happen all the time. The common route would be you have a full training done.
I was hoping, do you know Kirti? She's in Middle East. She's married to a neuroanesthetist in India, Manohar.
Yeah, she did a fellowship with us last year.
I was hoping she was doing, Naveen Manohar actually has messaged that she would like to join. And she's here now.
Nitin is here. Hi, Nitin. How are you?
Hello, sir. I'm good. Nice to see you all. I was hoping that she could join and share her experience of a fellowship in pediatric anesthesia and sick kids, but unfortunately she's working now, so I couldn't force her to
she's
join
there. She's joined now. Nitin?
No, sir. I think she's still busy, so she won't be able to join.
No, she is. Actually, I have just approved her joining.
Kirti Rao. Yeah,
Kirti Rao.
Yeah, maybe she can share her experience. And
hi, Kirti. You can come in.
I think she's having connection issues.
Must be. Yeah. But she has.
Yeah, we spent a lot of time when Kirti was here talking about this. Nitin is right. How they want to settle down, and then Nitin was looking at whether she come to Western to do fellowship.
Probably I'll just share our experience to the Indian people watching. So I have done my MD, and then I went on to do my DM neuroanesthesia. I was actually working in Hyderabad, where I was running a fellowship program myself, and I happened to apply for a neuroanesthesia fellowship because she was doing a pediatric anesthesia. She was very clear about wanting to do a pediatric anesthesia fellowship in sick kids. Her intent was very strong. I think she applied twice or thrice, and finally she could make it into the list. It's very competitive. That's what I can say to the Indian people, and go with a clear intent. The intent probably for Indian graduates should be to improve yourself as a, as an anesthetist, and everybody, including JD, also told me that have an exit plan. So that is what you should go there with. Do your 1-year fellowship, learn your skills, and then a longer route is very difficult. That is what everybody told us there. And but the 1 year that you spent there in Canada was it was very good for her. She learned a lot. She improved herself. So that was her journey. I was hoping that she could join and
She has joined. I can see her also. Kirti,
Yeah,
can you
she's
speak?
there now.
Hi, hi. A very good day to all of you. I'm so glad to be able to join. Thank you very much for having me here.
Hi, Kirti.
Hi, everyone. Hi, Jady.
Hey,
So
how
good
are
to
you?
all good, Jady. Sorry, I was just amidst a case, and then I just had to wait until I just shifted the patient. Sorry to join in late.
No problem at all. Go on. You can share your experience. How
Where
did
are
you
you now,
finish it?
So, I'm in Abu Dhabi now.
Oh, where?
I'm in Medeor Hospital in Abu Dhabi.
Okay, I spent 8 years there.
That's wonderful. So
in
nice.
Mafraq.
Okay.
Go ahead.
Yeah, so for me, since I had done a bit of pediatric anesthesia for a few years before I came to Toronto, after a few years in pediatric anesthesia, I kind of realized that there's a lot more to learn. In spite of the variety that we were doing back in India, it made sense to learn more variety and learn the experiences from people in world-class centers. And that's why I applied to SickKids specifically. And getting a fellowship in SickKids was like, it was like a once in a lifetime opportunity for me. It really was a wonderful experience working in SickKids, because when you're in SickKids, it's not like a department, it's like a family. It's a large family of anesthetists working together. They help each other, support each other. And through your fellowship, you're guided, you get groomed into a person who looks into details, who manages things very appropriately, and keeping in mind the patient care and at the first in front and in the mind. So that way, the skills, the experience, the knowledge, everything was groomed. And professionally, I think I just became a better person after being in SickKids for a year. The fellowship really was a wonderful experience for me. And I personally thank JD a lot for this. He has played a very, very supportive role, and he'll always be my role model for that.
Fantastic.
Thanks, Kirti, for that. It is like it takes a village to raise a kid, sort of thing. We have very specialist group of people. Like I don't need to be there. Even I wouldn't be if I'm not there. Is still the fellowship will go on, in the sense nothing will change. So everybody has that the best interest of the fellows in their mind when they have a fellow with them. It's never it's. I hate to use the word. I think Shiv has used the word a lot today about the donkey job sort of thing. We never treat that way. The fellows, the assignments are appropriate for what is needed for the fellow. We make sure that they get a right mix of independence as well as training. And we're trying to protect their academic time so that they can get on with their research program. So we make sure that it's a sort of a very balanced fellowship, both in work-life balance, so that they're not overworked, that they have time to prepare, time to spend with their family. It's and time to enjoy not only the hospital, the Toronto, what are the outside life in Toronto. Unfortunately, you had a bit of the COVID, is it right, Kirti? We had a few first to 3 months of COVID. She just finished in July, so yeah.
So despite the period that was taken away by the COVID stuff, last 4 months were COVID times. So in spite of that, the learning, I personally feel the learning wasn't hampered, because we were still doing a good fair amount of cases. And we learned a different set of things altogether, like, simulation-based learning, protocol formulation, how each thing evolves as the situation evolves, and how guidelines are formulated as the situation is evolving. These are the kind of things that we learn. So I think that makes that is put into good use in a person's long career of anesthesia, where he will be facing this kind of challenges and changing, evolving situations. And I think SickKids gear us up for that. That was a wonderful experience. I'm actually glad to have been there during the COVID time. I think being in sick kids.
Yeah, that's what people say. I mean, every fellow who finished at the time, they did not feel they in fact felt it's as you said, it's an opportunity to learn how to deal with this personally as well as emotionally, and how the department evolves, how the hospital evolves to deal with this scenario. The training wasn't hampered. We had still ended up with doing lots of emergencies and big elective cases anyway. Yeah.
So we will be just finishing 2 hours now. I really need to go in 5 minutes. So if anybody else has a question, please ask. Otherwise, I'm going to sign off in 5 minutes.
Yeah, I did actually just had it for 2 hours. I thought we wouldn't be going that long.
Yeah.
But it's been great. Kirti,
Rohit
thank you.
Agarwal has raised a hand.
Jyoti, sorry.
Yeah, hi.
Yeah.
Hi, Dr. Dhir. Hi.
Yes,
Thanks, Dr. Shiv and Dr. Dhir for organizing this. I'm one of not so active member of this group, but I'm working in Singapore at National University Hospital, and I'm primarily trained in anesthesia for liver transplant and intensive care. I did 2 years of fellowship in Toronto and University Health Network. It was wonderful time, and I can echo whatever was just now said, that its experience is really, cannot like it's one of the lifetime experience. The question I have is, like, we do get a lot of fellows from India who are pursuing either some kind of advanced general anesthesia fellowship or intensive care program with us. I can see the difference what was offered in Toronto versus what we can offer, and in terms of fellowship program in general, and specifically the career path that we have to offer. So unfortunately, Singapore, is very bit protective in terms of for the jobs for the future local trainees and all. So which is not possible. So when you're coming from Singapore, they may not be able to get absorbed. And a lot of people who come from India will have that kind of aspiration. And some of them are really good. And it's just that I feel that we're not able to help. So I'm not sure for the fellowship or for this kind of prospect. So is it possible to have some kind of channel established where I'm able to, forward some of these candidates to you to look into, and then help them out with another fellowship or future prospects? Is that possibility?
So that was for Shalini and Jody.
I think, from my perspective, I think they will have to apply individually. I'm not even sure whether there is any point in having a joint
fellowships
type of forum, because or place to apply, because otherwise, you cannot restrict it to certain people. It has to be the fellowships, like Jady said, they are open to everybody. And I think you got to apply at the particular website. I don't know. I mean, at the moment, I think they will have to apply individually.
What I can only suggest is that Shalini and Jody can guide these guys specifically.
Yes.
If somebody needs guidance, how to get their CV, or what points they need to have to score higher, or how to present themselves. I think that's how we can help. You can't actually have a direct channel. They say, okay, you come from Singapore, we'll take you in. I think that would be the right thing.
No. I think what I mean is not like that. What I mean is, sometimes they feel a little bit lost, and they are not sure whether they'll what are the prospects, because some of them did manage to go there and then they had a good time. Similar experience from
But Rohit, you have actually done fellowship in Toronto, so you probably would
I
be a
do.
good person to advise.
No, I do. I recommend to everybody, like all my juniors in Singapore, I said, you take a sabbatical. Just go 1 year and then go sabbatical, and then do advanced general anesthesia fellowship at Toronto General. I think it's a wonderful place. You get to work with all the who's who, because I had not worked in UK, so I cannot, definitely UK is one of the places to be, but in Toronto also it was good experience. I do recommend, but and then some of them are able to secure that, but somehow some of them are not able to, in case those who are dropped off or missed, opportunity. So what was missing in that? And definitely not to have a unobstructed path. It's not about unobstructed path, but it's at least some kind of guidance, local guidance kind of thing, who can look into and then advise them into proper way. Because I am not sure, because like how is the system now there at other than in Toronto, because Toronto UHN is particularly very competitive, and there is a lot
It's
of
the
waiting
same
for them to
everywhere.
become.
London, Ontario is equally
Yeah,
competitive.
it's equally competitive. Okay, good to know. Okay. Thanks, Dr. Dhir.
Thank
I
you,
think it
Rohit.
was pleasant talking. Thanks, Dr. Dhir.
Stu, I think they wanted we can do is in our the group Facebook group, we can create some media files or something where we can put up some slides about the different pathways. That will act as a primary and also some suggestions of how to improve your CV, what they're looking for, links to the different fellowships all across Canada, and then a separate section on long-term career settlement versus short-term opportunities. And that way people have some sort of a sense, and then we can have some links. If they still have any further questions, we can always answer them.
Yeah,
that's great. That's very helpful.
So what this will likely, I will create another unit on this one. So training abroad, which this will be one of the parts. So under the units, we can actually have files and stuff like that. So that's easy.
Great.
And this is just the beginning. And I think Jody, you need to get Kirti involved with the pediatric symposiums as well. I think it'll be nice to have somebody.
Kirti, we are running some symposium. You're going to be on the next one.
I'll make sure I'm on that one.
I don't need to ask your permission, right? I can just put your name. You'll come on.
Yeah. Thank you, Jady.